talk about human beings, regardless of race, our belief, or economic status, we are all the same. And our healthcare needs are basic needs. The communities that we live in, either in Sierra Leone or in Kentucky, are in need of compassion. And much of the time, we as health professionals have always tried to practice our profession against the background of mere skill without injecting some parcel of compassion and love and empathy into it. So you will notice that many times patients are denied health care because they are suffering from life-threatening illnesses, and they say, go home and die, we cannot help you further. And that care burden troubles the family caregivers, or family members who are very often unprepared. So what I see as a need is that we should make our health services, we should make our palliative care services reaching out to people in their own homes, in their communities, and involving caregivers such as their family members in the care provision, such that we empower family members and make sure loved ones stay around patients in their homes. I think I have realized that as a need. It is a need in Sierra Leone. So it is really about reaching out to people with care such that it gives quality and dignity to life. Sierra Leone went through war 12 years, and that war ended in 2002. And Shepherd's Hospice, a palliative care service, was founded somewhere mid the Civil War, which means about 60% of the population was living in displaced camps. And patients who were diagnosed with HIV and other life-threatening illnesses could not be prioritized by the public health service and even by other community health service providers. So that gave us every concern to start providing palliative care. But we needed some twinning, some partner in the United States to see how whatever work we are doing, how we can learn from our partners in the United States. And for the very first time, we received a visit from Hospiral's team. I think it was wonderful, it was great. The nurse team from Hospiral's was busy providing some coaching for our team, teaching them some basic skills of palliative care, going out to the community, providing some tips as to how care is provided back in the United States. I have always been in health, but not in palliative care, and I never knew about palliative care until 2005. As public health officer, I was in charge of a district, and I realized that patients were diagnosed with HIV and AIDS, with cancer, and they could just be asked to go home because nothing could be done for them. Well, that became very, very serious. And I started asking myself what to do. I was approaching physicians, doctors, the district medical office. I said, but we have to do something. And they kept telling me, no, Gabriel, we cannot do more than what we can cure. Yeah, but I said, the patients are suffering and we have to do something. So they threw the question back to me, what do you think we can do? I said, no, but we have to find something to do. I was a little hesitant at the start, but I kept hearing a voice speaking to me that we have to care. So that made me to think about building a team consisting of a chaplain, a nurse, a clinical officer, a social worker, and that is just how we formed the team. I have never learned about palliative. I never knew there was anything like palliative care, except that I had the urge that we really have to care for people because they are suffering from pain and they were suffering from very severe pain. We were able to increase their knowledge about pain and making sure that you are not just treating people as mere subjects of disease. One case of tuberculosis, one case of cancer, one case of malaria, but you treat them as Margaret, Mary, and John. So that means you treat them through the concept of total pain, making sure their spiritual, their physical, their social, and emotional well-being is all catered for. Our approach to providing palliative care is the multidisciplinary team approach. Much of what we do is making sure that we reach patients not only as individual patients, Margaret, but we reach the patient together with the family. Family members, we did a study to see how could we involve them. What is their perception about death and dying? We realized that people would prefer to stay home, surrounded by loved ones, in the comfort of their home, to see how they can die. Traditionally, as Africans, people have been dying at home. Anytime there was a need to die, somebody would say, do me one favor, take me to my house. Take me to my father. Take me to my mother. Take me to my son. So when we did a study, we realized that people's preference, family members, their wishes is to see a healthcare worker leaving the comfort of his chair and office and going to the home and helping to train family members such that even when the healthcare worker is away, they can administer simple drug medication, they can wash the patient, they can clean the patient, they can turn the patient, they can communicate with the patient, and above all, help the patient to take his or her medications. And that is a wonderful approach. We realize that it's reduced cost. And when we presented to the Ministry of Health and Sanitation, they were so happy. The World Health Organization also funded us. Don't forget, palliative care strengthens health systems. You see, the unique thing about the donation we have received from hospitals is that it gives us an opportunity to look at gaps and fill those gaps, and that made us very proud. So hospitals is really supporting our work, and above all, we have increased our staff, especially our team. We used to have one team, and now we have a community outreach team. And 2 of those team members are paid by hospitals. The business of providing palliative care and caring for patients with life-threatening illnesses and making sure you put life into their remaining days and make it meaningful is a very unique quality of hospice people. And until you have that spirit, you cannot do the job. So if I have any message for workers who go up in, and down in difficult terrains, is that we have to nurture a community of compassion. We have to care for loved ones. Otherwise, humanity will lose its value. And we care today so that tomorrow, when we need it, somebody is by our bedside to care to.